Good day, ladies and gentlemen. Thank you for following us. Today is 18th day of July, and it is set aside by the United Nations as World Hepatitis Day. So today we want to learn about hepatitis. As we all know that on this channel, what we do is we pick a particular disease condition, we talk about it, then we look for preventive measures so that we will not have a disease society. Our aim and objective is to create awareness in a way to ensure that everybody in the society is healthy. So follow us as we'll be discussing about hepatitis. Thank you so much. So let's look at hepatitis. What is hepatitis? It is the inflammatory disease of the liver tissue, which is the inflammation of the liver cells. What are the liver cells? The hepatocytes. And we know how important our liver is to us. Before I will continue, we all know and we are familiar about kidney transplants and so many other organs in our body that are usually being transplanted whenever the organ fails. So this is telling us how much of importance is attached to these our internal organs. So now we're talking about hepatitis, and we know that it usually affects the liver. Now let's look at the functions of liver so that we can appreciate the dangers or the disadvantages of this disease condition. So we know that our liver is responsible for filtration, and also it is responsible for digestion, also for metabolism and detoxification. For example, when we use certain drugs or we eat some food substances, these are being detoxified because at times they contain one or two forms of toxin. Also for protein synthesis, a lot of proteins in our body that are used as enzymes, as bioamines, and a lot of things, they are being secreted by this or synthesized by this liver. Also for storage of vitamins and minerals. Now, what are the types of hepatitis? There are a lot of them, usually 5 of them. There is hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. They usually occur as a result of different factors. Now, what are the symptoms of hepatitis? We usually know that the symptoms are those things that when we see them, it will tell us that yes, this person has hepatitis. Usually, we cannot declare that somebody has hepatitis without running tests. But when we see these symptoms, it means we need to go and do checkup for us to be sure whether this person has hepatitis or not. One of it is poor appetite. Another one is yellowish skin, then abdominal pain. So usually there may be jaundice. So when jaundice occur, we can also we can do the liver test, or we can go and run hepatitis test. Then what are the complications of hepatitis? Hepatitis can cause liver failure. Also, it can cause liver cancer. That's cancer of the liver cells. Then what are the causes of hepatitis? Usually hepatitis is caused by virus and also alcohol use. When one drinks alcohol, hepatitis condition can occur. Also, hepatitis can occur as a result of toxins, as a result of autoimmune. Hepatitis can also occur. Now, the virus, for virus to cause hepatitis in a particular person, it means this person has contracted the virus through unprotected sexual intercourse. Then also, one can contract hepatitis through contaminated food and water. Then also, one can contract hepatitis through receiving of blood or contact with the blood of infected individual. So when somebody has hepatitis condition and there is an opening, maybe in the arm or any part of the body, hepatitis condition could occur if there is contact within the blood of individual and the person that has hepatitis. The part of the complication of hepatitis, apart from liver failure and liver cancer, is death. And it is estimated that over 1 million people die of hepatitis yearly. So we can see how dangerous this disease condition is. Now, to us, what we are interested in is how to prevent hepatitis. So the prevention of hepatitis is through vaccination. There is a particular vaccine that when we go to our hospital and we tell them that we want to take hepatitis vaccine, they will give this vaccine to us. Then apart from this, so this vaccine, what it does is it prevents the hepatitis that is being caused by virus. Then also avoid alcohol. So we know that alcohol, it destroys the liver. And when the liver is destroyed, that is due to the inflammation of the liver cells. And when inflammation of the liver cells occur, we say the person has hepatitis. So which means, in other words, it is advisable that we stay away from usage of alcohol. Then treatment. So for those people that has hepatitis, they doesn't need to lose hope. They doesn't need to get depressed. They need medication. And for those that have very severe cases, which are usually when there is total liver damage, so these people, they need liver transplant. And this is a very positive solution, which means these people, they can get ill when they do liver transplant. And for those people who just contracted the disease, they can use their medication, and over time they get over the disease condition. Our recommendation at the end of this video is that everyone should endeavor to make sure they do hepatitis test. For those people who have the condition, it will be easier for them to manage at the early stage. And for those people who doesn't have it, they will know that taking the vaccine will help them to protect their body from getting this condition. So please, let's make sure we do hepatitis test and get vaccinated. Thank you so much for following our videos. We do hope you've learned one or two things from our video, and we do hope that you are going to like the video. We want to have your comments in the comment section. We want you to share this video so that other people can learn from this information. Our aim, as we said at the beginning of this video, is to create a healthy society, and you can help us to achieve this aim by spreading this video. Let it go viral. Let everybody see this. Thank you so much. Bye for now.